The AAP does not recommend the use of blankets for sleep for infants under 12 months of age. The reasons why is 1, suffocation. The blanket can get around the infant's face, causing them not to breathe correctly. 2 would be overheating, which causes the infant's body to get too warm. 3 would be strangulation, where the blanket could get around the infant's neck. However, with licensing, you are allowed to use 1 blanket with written parental permission. However, if you do not feel comfortable allowing blankets within your program, you have every right to refuse the use of blankets within your program. You just make sure that it's stated in your policy. There are several types of blankets. If you are allowing the use of blankets, I would recommend that you use a thin one. Thin would be something such as this. As you can tell, it's a very thin blanket. This is another option too, another one that you might use that would be considered thin. So those 2 are options. There are several types of blankets that I do see that are thick. One would be the quilted. So as you can tell, this would be something that is thicker. This is another type that I see many times in childcare too, that is more bulky, thicker. And then the tie blankets are also ones that I see very commonly. It's the type that has 2 layers of fleece, and then obviously it's cut and tied. So with all that fringe and the extra material, that's where that could be a hazard. And with all of the thicker blankets, the infant is just put at more at risk for overheating and for suffocation. The other issue that I see with blankets sometimes in childcare is they want to use blankets to either block out sound or block out light. So therefore they will take a blanket and hang it on the sides or over the top, such as this. Or draping over the top. And either way is not allowable by licensing. And if you're wondering why, it's just putting the infant at risk for suffocation, overheating, strangulation, because the blanket itself might just accidentally fall into the pack and play or into the crib environment, or someone could bump it, or the infant themselves could be able to pull it down on themselves. When using blankets, if you do allow them in your program, this is how it's recommended to use a blanket. First, place the infant in the pack and play or in the crib on his or her back. And with the blanket, you just want to make sure that the arms are above the blanket and the blanket's only placed nipple high. Tuck it in on the 3 sides. And then you can lay there, depending on if the infant does this his or herself, but just make sure that the arms are above the blanket's nipple high, and it's tucked in on the 3 sides.